Just someone was like, 5 months sounds good. Seems a little silly, but you know.
Can I just make a little comment?
Yeah, of course.
It's DSPD, in case people want to write it down, because it's the Department for Service.
Yes, you're right. Yes.
That's why I'm so confused, but
you're
it's
right.
all the same thing.
No, you're 100% right, and that's funny to me because
you've been saying it DSPD, you said
yes,
it right.
yes, and it's funny that you say that because every time I say it, you may have noticed me like catching myself. I'm like, it's not that, it's not that. Like I always switch those up, but yes, thank you for clarifying. You're totally right.
If you Google it, it comes up either way.
Yeah, I'm sure it would, but still, that's good. That's a good thing to know. Okay, questions about any of those things so far before we jump into like Medicare and Medicaid, which is sort of fun. Okay, so let's talk a little bit about Medicare and Medicaid. Medicare is, again, the health insurance provided to individuals who reach 65 or those who qualify via Social Security disability insurance. So Medicare is a confusing process, a confusing insurance that is hard for a lot of people to understand because they try and make it confusing, I think. If you are not qualifying for Medicare, the chances are you know someone who is or will be very soon. So this is, I think, useful for pretty much everyone to know. My mom qualifies for Medicare in like 1 month, and she's like been getting so much mail from all these different insurance companies and from the government, and I'm like, just ignore it all. I'll tell you everything you need to know. So this is a useful thing, I think, for everyone. So Medicare works through these different parts. You have A and B, Part C and Part D. A and B is traditional Medicare. It is when you turn 65 or when you qualify for Social Security disability, 5 months later, your Medicare Part A automatically turns on, and that's your inpatient or hospital benefit. So you automatically get access to that when you turn 65 or when you qualify, no matter what. And then you have the option of when you'd like to turn on your Part B, which is your outpatient and doctor's benefit. Medicare, traditional A and B Medicare covers individuals at an 80-20 split. So the government pays for 80% and you pay for 20% with no cap. So initially when Medicare was created, there was not a lot of, medicine wasn't really done in an outpatient setting. Most medicine was done in an inpatient hospital setting. And so they thought, you know what, as long as we pay for hospital services, there's not going to be a lot that people will be paying for in that 20% because no one just goes to the doctor for a quick visit. Everyone was taken into the hospital and stayed overnight and had an inpatient experience. Obviously that's completely changed now, and so because there's no cap for that 20%, you can end up paying a lot of money. It's literally completely uncapped. So if you have $1 million procedure or $1 million medication, which we know in today's world is not out of the question at all, you could end up paying $200,000, which is a lot of money. Yeah?
So are there wellness preventative care benefits, or you still pay 20% of that?
So under the Affordable Care Act, there is all insurances provide a free wellness check.
And
yeah.
then flu shots and that.
Exactly. Yep.
Okay.
Yeah, exactly.
So that's still covered. Is that under Medicare Part B then?
Yes.
Okay. So people will qualify for A and they won't qualify for B, but then once the B.
Right, and you do automatically qualify for B. You just have a choice of when you'd want to turn B on. So an example of that would be if you turn 65 and you're still working and your insurance and your job is providing insurance, you don't maybe necessarily want to turn B on right away because you don't want to pay a Medicare premium when you're already paying a private healthcare plan premium.
Does it change what your premium will be later if you turn on later? Is there
no, they do it changes from year to year, goes up slightly up every year, but no.
Like Social Security, for example, sometimes when you wait, you get a better benefit.
That's right. No, it's right now it's $135 I think a month, and that's just the it will be the 2020 premium, and that's just, it doesn't matter when you turn it on. Yeah, unless you turn on in 2021 and maybe it'll go up to 140 or whatever.
Yeah, but there's no benefit. So if it's cheaper than your work, you might consider going on Medicare instead of your work.
Well, if you have access to a work, yeah, exactly.
It's going to be better almost always, but sometimes they have these horrible high deductible plans that really make it better do 80-20 if you don't go in at all.
Right, exactly.
Okay.
Yeah.
Interesting. Thank you.
One thing to note, however, is if you have access to a work plan, Medicare always is secondary. So you can be double covered, but Medicare will always pick up, with a couple exceptions. If you work for a company that has 20 or less employees, Medicare will be primary. If you have a disability and you work for a company that has 100 or less employees, Medicare will be primary. But generally speaking, Medicare is pretty much always secondary. Sorry, my watch is buzzing. It's very distracting. So because of that endless 20% cap, right, we at some point the government was like, this isn't affordable for people anymore. So about 15 years ago or so, they started kind of reconsidering what they were going to do, and they added Part C and Part D. And they also added supplement plans, which we'll talk about. Can I go over here and draw? So when you opt into Medicare, you have 3 options. Everyone gets A and B. It's not a very good pen. Everyone gets A and B. Option 1 is just to keep your A and B only and not do anything. Like that will be your traditional 80-20 split with no cap, right? You just keep A and B. Option 2 is to go with Part C, and option 3 is to do a supplemental plan. So when they realized that 20% was getting really expensive, they added something called Part C, which is essentially the government was like, we can't actually afford to manage everybody's Medicare. This is a lot of people, and this is getting really expensive for us. So we're going to contract some private companies to manage your Medicare. So when you get close to, or when you have a family member that gets close to being eligible for Medicare, they're going to start getting tons of mail from like Select Health, and from Blue Cross Blue Shield, and from AARP, because all these plans are getting paid by the government if you jump onto their Medicare plan. So Part C is or what we call Medicare Advantage or Managed Care Plan, is a private company that is that the government pays to manage your Medicare. And then the final option, so you can do this, if you opt into this option, this is your A and B. This is everything all under one umbrella. It's just called Part C. So A and B goes away, it's Part C. It includes your outpatient, your inpatient, and your drug benefit, all under here.
And 80-20 or whatever
that goes away because now it's whatever they say, basically.
So it's variable now, depends on the company.
Correct. Usually these managed care plans give you an out-of-pocket maximum, so it's not like an endless, it's about, most of the ones that I was reading for 2020 are like between $4,000 and $5,500. So
does it cost more a month than the $135?
No. So you pay your $135 no matter what. You turn on your Part B and you pay your $135. But these managed care plans often have a 0 or really low premium. That's why they're really attractive to people, because people are like, sweet, I don't want to pay any more than $135 a month. I think I'm just gonna opt into one of these.
What's the downside? It seems like a no-brainer.
Right. So there is a downside, and I'll tell you about it. After I tell you about the third option, which explains the downside. So the third option is to do A and B plus a supplemental plan. The supplemental plan covers the 20% in full, so you're going to pay maybe $100, between $100 and $150 extra a month to pay for this supplemental plan, which will cover that 20% in full. So if you opt into this option, you're paying nothing really ever again. Like everything will be paid for at all times, because so it's a very fixed cost, right? You know, you can budget, I'm going to pay $130 extra a month, and I will have no other costs. The other big piece of this one is if you go in A and B plus a supplemental, your network is the United States of America. Anywhere that takes Medicare takes A and B and your supplement. Like there's no limitations. This is really popular, especially for people that travel a lot or live in one place for half the year and one place for the other half of the year. Or if you get sick and you want to visit a specific doctor, an expert in a specific condition, no issues, no problems. The downside to the managed care plans, so the downside to this plan is you're paying more per month. It's a fixed cost, but you are paying more per month. You're paying, $130 extra, I think is about what the supplemental plans cost monthly for 2020. The downside to this, you have a really low premium, but your costs aren't fixed. You have to pay copays, right? Because it's just a normal healthcare plan, right? So you're paying copays, sometimes up to $60 for a specialist. Because this is an HMO or a health maintenance organization, they're going to dictate who you can see, what network you can see them in. If you need a referral for a specialist, there's just a lot more management that comes along with it, because it's a HMO that can save money by having you see them in network. The popular managed care plans in Utah are Regents, Select Health, and AARP. Select Health, for example, right, like you can see anyone in the Intermountain Network, but you can't go outside of that. If you get sick in California, like you can go to the emergency room and emergency costs are covered, but you can't go see another doctor. So a lot of times for our patients who have really specific medical conditions and they have to see specific specialists for them, we often encourage them to kind of stay away from these plans because we want them to have access to anyone that they want at any time.
So what is who are supplement people?
Who are they? The common ones in Utah are Regents and AARP, but it doesn't matter who's covering your supplement. You can see anyone. Like, they are required to let you see any doctor as long as they accept Medicare, as long as they cover Medicare, which most will because Medicare reimburses well. Medicaid is another story. So pros and cons, right? This is a cheaper monthly, option. This is a little bit more expensive monthly, but the costs are a little bit more variable here, and they're managing your care, so you have a lot less options. I, as a social worker and as a public policy nerd, feel a little bit of an ethical conflict from telling you what to do, but if I were to tell you what to do, I would tell you to do this, because I just have seen so many situations where individuals lose coverage or can't make decisions or have a lot of expensive costs because they want this managed care. It seems great on the surface, and oftentimes it can be a little bit more complex. The other big piece to note that's really important is once you turn your B on, you have the option of picking one of these 3 options. You only have 6 months from when you turn your B on to be guaranteed to be covered by a supplement. So after your 6 months expires from when you turn your B on, you can still apply to get supplemental coverage, but you're not guaranteed to get it. So I've had patients before who are choose this managed care option because it's cheaper per monthly and because they're not sick at the time. And then maybe they get diagnosed with cancer or their disease progresses, and they're like, shoot, I want to go back to the supplement, and they most likely won't be able to get coverage anymore because they can choose to deny you after 6 months. I did just learn about a loophole to this, but I haven't researched it myself, and so take this with a grain of salt and do your own research, but I did just learn that if you move to a different county, say you have a child or a friend or something that you can move to, they have to approve you. The supplemental plans have to approve you. Again, I just learned that just recently. It's apparently not a common thing that people know about, and I did more research. But generally speaking, it's really safe if you think, at some point you're going to need extensive medical care to go with the supplemental option as a fixed cost. And that's kind of the overview. There's some more nuancy pieces to it, so you have specific questions about your situation, feel free to ask me. But that's kind of what Medicare looks like. Oh, and then finally, there's Part D, which is the prescription drug plan. The traditional Medicare doesn't have any coverage for prescription drugs. So when you choose Part C, the drug benefit is rolled into the plan. If you choose the supplemental plan, you have to pay an additional drug premium, which can vary between $10 and $25, $30. So that is another reason why sometimes people choose Part C, is simply for the convenience of not having to carry around 3 different cards, right? That's kind of annoying. When you choose Part C, everything's rolled into one. When you choose A and B with a supplement, you have your A card, your B card, and your D card. And you're paying essentially 3 different premiums. Does anyone have questions about that? It's kind of a lot. Yeah?
I have a question about Medicare as far as if you're receiving Medicare because of, I have a disability, and when you turn 65, then does that change? Is there something you're supposed to do, or does it just stay the same?
Stays the same. And once you qualify for Medicare through disability, you'll have it for the rest of your life. Yeah. Or unless something were to change in your diagnosis or your condition. Did you have a question?
Just DME. I know that falls under B. Does C just pick it up somehow too?
Yeah. So I was reading all the plans. It sounds like a fun life, huh?
Obviously you enjoy it. Thank goodness you do. So.
Yeah. So different plans have different DME. Different DME things, right? So that's the other piece is when you go supplement, it's covered under whatever Medicare covers, which is usually at 100%. Whereas the managed care plans can decide, we want you to pay 20% co-insurance, or we want you to do this and this and this, right? They can pick, it varies from person to person. But the big thing too is the reason why there's so many C plans trying to get you is because you're worth $8,000 a year to them, because that's how much the government pays them to manage your care. So as you qualify for Medicare, you have friends and family who start to qualify, just know what all those, I think it's useful and helpful for you to know what all those pieces of mail you're getting. I had a patient just Wednesday, who had been on a supplemental plan, the A and B supplement, and this time of year, because it's open enrollment, someone had sent her like a thing, like I think it was Melina had sent her an insurance thing that was like, come over to us and you'll pay a 0-month premium, which sounded super attractive to her because she was paying $130 in her supplement or whatever, right? And they got her to move over, and they didn't tell her, they didn't disclose to her what that meant for her care. And so we're trying to make an appeal. She has 30 days to appeal, like her choice to move over to that. But she has ALS, so like it's, yeah, unless we can get that appeal granted, like it's unlikely that supplement's going to cover her. So just be aware of what you're doing when you pick Part C. A lot of times it's a good option for people, but a lot of times it'll be a little misleading. Yeah. Questions about any of that?
So the supplementals basically double the monthly cost. You're doubling the cost.
You're doubling your fixed monthly cost. Correct.
Fixed monthly. That's very
and that's
specific.
important, yeah, because you are doubling your fixed monthly cost, but you're not necessarily doubling your costs because if you are,
right.
yeah, if you're saying if every specialist, so every time everyone here has had interactions with a specialist physician, every time you see a specialist, it's costing you $60, right? So it's like, it's not necessarily doubling your total cost, but it is doubling your fixed cost.
Sure.
So if you can budget for that, if you can figure out a way to budget for that fixed cost every month, you know exactly what you're going to have to pay. That's helpful for people to know. Yeah.
Sure. Okay, thank you.
Yeah.
Did you already talk about refusal to cover and things like that? Because I know with a lot of like the legislation that's been passed, they can't refuse to cover you for things
Right.
like that. How is that?
Right. So, like I said, you have 6 months. So after A and B, you have 6 months to get on a supplement plan. And for one, I think for A or P, it's actually 2 years, but I'm not positive, so don't quote me on that. And they have to cover you. Like they are required by law to cover you. No matter how sick you are, no matter how much medical care you need, you have 6 months and they have to do it. After that 6 months, supplements can choose whether or not they want to bring you onto their plan. As far as C plans, they're required to cover you. There's no like exemptions for that. And that's also important, right? Because I had another patient who was initially on an A and B and a supplement, had a friend at church. She was this older lady. Had a friend at church tell her like, "Well, I'm only paying $20 a month for my insurance." And she's like, "That sounds great." Made the choice without talking to like her kids or her her healthcare agents or anyone in her medical team. Switched over, and we were all like, "Oh, well, that's not great, but it's not the worst thing in the world. At least she still has insurance." And then her daughter called Medicare because she wanted her to get back on the supplement, and so she called Medicare and she's like, "What do I do?" And Medicare is not going to tell you one way or the